Hello, I'm Sabrina, one of the licensed technicians here at Stack Veterinary Hospital. This video is going to be the first video in a series that we will be creating with the goal of making you more comfortable in caring for your diabetic pet at home. It's important to understand that diabetes mellitus results from a lack of insulin or insulin resistance. Insulin is the hormone in the body that allows glucose or sugar into the cells to be used for energy. Without it, excess glucose will be in the blood, which is known as hyperglycemia, and it can be shed into the urine, which is called glucosuria. Therefore, the foundation of treatment for diabetes is administering insulin injections to your pet. Insulin comes in two different concentrations with matching syringes. There is U100 syringes for 100 units per milliliter insulin, and there are U40 syringes for 40 units per milliliter insulin. Each time you get a new box of insulin syringes from the pharmacy, you should ensure that they match the type of insulin that your pet has been prescribed. Using the incorrect type of insulin syringe to administer insulin can result in over or underdosing of your pet. When it comes to insulin storage, it should be stored in the fridge and it should not be frozen. You should avoid storing it on the fridge door, as this can result in inadvertent shaking of the insulin, which can damage the insulin. When it comes time to draw up your insulin to give an injection, it should be inspected each time to ensure that there are no color changes or clumping of the insulin. If you do notice color changes or clumping, this can be an indicator that you need to replace your insulin. Insulin should be replaced at least every 6 months. It's also important to note that insulin does bind to plastic and can be damaged by ultraviolet light. Therefore, you should never preload your insulin into syringes or store it in syringes, as it can decrease the effectiveness of the insulin. You should also avoid storing your insulin vial upside down, as there is potential for it to bind to the stopper of the vial. When dosing insulin, if you think there may have been an error made during administration, such as some of the insulin going under the skin and some of it going on the fur, you should never re-administer the injection. Or if you suspect that another caretaker may have already given the pet insulin, just skip the insulin dose until the pet is due for the next one. Overdosing insulin can be very dangerous, therefore it's better to just skip the injection if there is any doubt. When it comes time to draw up your insulin, you need to resuspend it. This can be done by gently rolling the insulin bottle between your hands. The insulin should never be shaken, as this can cause damage to the insulin. Unless you have Veterinary brand insulin, then it should be shaken until it is the same throughout and forms a white solution. To draw up your insulin, insert your syringe through the vial stopper. Pull the plunger back to the dose that you need for your pet. If you get bubbles in the syringe during this process, with the syringe still inserted into the insulin, flick the side of it so the bubbles will float to the top. Then you can use the plunger to push the air back into the bottle. Then, re-drop the insulin to the line that is the correct dose for your pet. Once you've done this, you're ready to administer the insulin to your pet. The image shown here displays the difference between U100 and U40 syringes. 10.5 units in a U100 syringe looks very different from 10.5 units in a U40 syringe. Again, they are not interchangeable, so use the correct syringe for the type of insulin that you have. As far as for giving insulin injections, we are going to be providing some links in the description of this video to a video on our YouTube channel that demonstrates how to give a subcutaneous injection, and we will also be providing some links to the American Animal Hospital Association's videos on insulin administration. There is a specific video for cats as well as one for dogs. When disposing of your syringes, you can use a sharps container, or you can use a heavy-duty plastic container, such as an empty bleach container or laundry detergent bottle. Whatever container you choose, it should not be glass, as these containers can be broken and there's potential for the sharps to be released. The container should be labeled with a non-washable marker that indicates sharps on the container. When it is 3/4 of the way full, place the cap back on and duct tape it on. As far as disposal goes from there, all non-federal hospitals and nursing homes are required to accept used sharps produced at home, or they can be disposed of in the trash once they are sealed in the container as we just described. They should never be recycled. It's also important to note that you should never place loose sharps in the garbage or in the toilet. We will be providing links below for more information on sharps disposal and disposal locations. For more diabetic and veterinary related YouTube videos, please subscribe to our YouTube channel. If you have any questions, don't hesitate to call our hospital. Thank you for watching.